Hey guys, what's up? Alex here, and I gotta apologize. My days are normally Saturday, sorry, but I've been sick, and then my computer just wouldn't upload the video, so my cousin is letting me use his computer, and I'm gonna make the video again. This week we're talking about bottom health, and um, I'm a little sick. I think this also could be reworded to include like maybe reproductive health, but I guess there's more elements than just reproductive organs. So, one time I had an ingrown pubic hair, and it was completely uncomfortable, and I was doing manual labor at the time. It was when I was in college, so I worked at like a mechanic a quick lube service, right? So anyway, I had a lot of movement, and it was just so uncomfortable. And even though it was like maybe a little embarrassing to call up and make the appointment, I'm gonna go see what the hell's up. And it turned out it was just an ingrown hair, and I had to sit in the tub, and we didn't lance it or anything. But when it comes to health, and if there's something wrong or possibility of it, becoming a serious risk, I'm just gonna swallow whatever issue I have and get it taken care of. I'm not that too concerned with how it appears, even if I'm being read as male. So one thing that everyone talked about is pap smears. I get a pap smear every year. It's nice because at my work, all preventative health care is covered 100% by my insurance, and we also have a nurse practitioner in the building. So every single month they have like women's health days. I think it's 2 or 3 days where you can make an appointment, and it's an outside agency that comes in and does a pap. So I did that last February, and I'll do it again this February. I told the nurse that I was trans, and I hadn't had surgery and been on T or anything like that, and she'd never worked with trans patients, but she was very conscientious. She was kind, and communicated what her next step was, and she gave me a breast exam and was very like just communicative. Oh, now I'm gonna do this now, and that helped kind of ease the tension. I think I would prefer a female gynecologist for that reason, but yeah. So it's preventative healthcare. It's good to get it done. It hurts. My last one almost felt like I was on my period. Like I bled a lot after, and it's not pleasant. But I don't know. I don't think probably getting your prostate checked is very pleasant either, right? Having a doctor put his fingers up your butt doesn't seem very pleasant. So I think it doesn't really correlate with gender issues. It's just uncomfortable for anyone, really. But so I'll just continue to do it that way. I think if I didn't feel like the healthcare staff at my work was considerate, I would just go to Planned Parenthood. So, my periods, I have had very intense periods my entire life. In fact, I'm on a disability accommodation at work because of it. And not only do I have really intense periods, I also have very intense ovulation cycles, and it's every other ovulation, so I think it's on my right side. There's not really anything to correlate why, but it's really intense, and I get really emotional, and not only just like from the hormonal aspect of it, but there's also the fear that I'm having such intense pain now, and I will have it again in 2 weeks, especially when it's the ovulation time as well. Otherwise, I might get a month before I have this intense pain, right? But it's it's a psychological toll knowing that I'm going to experience this discomfort in the very near future. And I've been wary to start birth control because I knew that I was going to be on T, and so I just kind of toughed it out for the last 8 to 9 months. I didn't know it was going to take me this long to get on T, so I'm 1 month on T. I think I'm getting a little voice shift, but I'm also just kind of sick too. But so yeah, I didn't try birth control. which leads us to the topic of hysterectomies. So this information that I got came from the gender conference that I attended about a month ago here in Salt Lake City. It was a really good conference where there's a lot of different topics discussed. So I went to a workshop that included like a practitioner, and she's lesbian, and so she's also very knowledgeable in transgender healthcare, and I hope to get to see her. She'd be out of network, so it'd be 60%, but I think she would be who I go through to get my histo started. So I got a lot of information from her. This is where this is coming from, just FYI, okay? The thing about hysterectomies is that for trans men, there's not long-term data, and that's something we all know. So there's kind of a lab rat element to it that I'm just not too keen on. Personally, I haven't been swayed one way or the other if it's medically necessary for someone who's on testosterone to receive a hysterectomy. I think in certain situations it is, and I think if you get to a certain point in your transition and then you have complications, it's like a $23,000 procedure, so it's not one that you can just save up a year and get a hysterectomy, especially if you're having like severe issues, right? So I think it becomes a medical necessity because of the system, but I'm just not sold on it as a preventative healthcare measure as a whole for transgender healthcare. Personally, I do need one. My periods have been so intense, and even if I know testosterone is going to stop that, but I think the underlying issue needs to be addressed and it not just kind of covered from my experience. The thing to keep in mind that I learned on this conference was trans men, so women, about 10% of women have complicated periods, and 50% of trans men have complications with their periods. So this inverse relationship, I mean, I think it's very correlated with like a psychological thing for me, at least. I'm not saying as a whole, but there's a psychological element too that I'm unsure how it plays out. But so for me, I do need a hysto. I don't know if I'm sold on a partial hysterectomy or full hysterectomy, and what I'm uncomfortable about is the necessity of having to take a hormone for the rest of my life after a hysterectomy. Because not that I plan on going off of T, but if I did, I could, because I have hormones in my own system. So it may not be the one that I want, but I wouldn't be dependent upon a medicine or an outside source. And then I travel, I just think it's a little bit less, it's a little too dependent upon something than my comfort level. But so that's a factor in my decision making as well. At the gender conference, I learned more about the repercussions of having hysterectomy. So first of all, your uterus provides structural integrity, and when you lose that, there's a loss of integrity there. The anal prolapse can be a very real issue, and to fix prolapse, you have to have surgery. So that's one thing that I wasn't aware of, which is less than exciting. There also your canal shrinks, so if you have penetrative sex, then that could be an issue. You also become very dry, and that becomes an issue when it comes to safe sex, and I'll get to that in a moment. So actually, yeah, okay. When it comes to safe sex, and testosterone theoretically is supposed to make you like lose lubrication as well. That hasn't been my experience. I don't know if that's everyone's experience, but I think that's what this doctor was saying. So that on top of a hysterectomy, if you do have penetrative sex, it's really important to use a condom, but that's also going to create more abrasions. So you have to use lube. It's a huge aspect of safe sex with that situation. This wasn't on the topic, but I do think it's not necessarily bottom health, but it's reproductive health, would be breast exams. So even though I've had top surgery, my surgeon still recommends breast exams because I still have breast tissue. I wouldn't be able to have a mammogram because there's nothing to pinch, but on a whole, about 90% of the breast tissue is removed in top surgery, so there's still that possibility. So that's something to be said. I don't know if people were aware of that. Other issues with safe sex. Well, I don't practice barrier sex. Like, I'm not going to use a dental dam. I also don't have very frequent and different partners, though I think if I was to become more engaged with a number of partners, that would be something I would have to reevaluate. Like, I'm not going to have, like, when I had a boyfriend in Korea, I didn't have him wear a condom to give him a blowjob, right? But, you know, that might be something that I would, like I said, have to reevaluate if I have multiple partners in the future. I think this is actually kind of funny, though. I mean, I guess it is safe sex, but I am really excited for the moment that I put a condom on my own strap, which is funny. Like, I think it kind of would add something that I get excited about, thinking safe sex, but it's also just a different sexual practice. So that was something that I thought was funny. Okay, and then the last thing that I was going to touch on was growth. You know, I'm 1 month on testosterone, so I have experienced a lot of growth, actually. But as far as cleanliness, I don't really, it's not necessarily about growth, it's that I'm always aroused. And so, a lubrication is not an issue for me, and I have to shower frequently because of that simple fact that, like, I have this musty crotch smell. It's gross. So I guess I should talk about that on the internet, how gross that is, but I've had better ideas than that. I am pumping. I pump twice a day, and I think that kind of helps because my head pops out more, and so it's just really easy to clean. It's just like even easier because I can pull my foreskin back better, right? So yeah, I haven't had any complications on tea, so I don't have anything to touch on with that. And yeah, some of these topics, I don't know if I really had anything to add. So 12 minutes later, there's what I have to say on that subject. Okay, guys, I hope you're well. I'm gonna go drink some tea and watch The Closer. I totally have a thing for Kara Sedgwick. I have a thing for Southern women. I think Southern women is the reason to move to the South. I'm telling you, I want a debutante. I want a Blanche Devereaux, but maybe not so slutty. All right, guys, take care.